Hello, everyone. We've got a fair amount to cover today. As the governor very astutely pointed out, I want everyone to take a deep breath. I know that hearing the number of 355 cases was a bit of a shock to people, and we have anticipated an uptick in the cases. It's scary, it's human to be scared, and it's also something that we are preparing for very passionately to make sure we save lives. So let's go over the numbers a bit. We have 355 new cases today. As you heard, a significant number of them are at OCCC, which they did a good proactive job in testing for. And we'll hear more from the director about that today. I want to give some basic perspective, though, so you see very clearly how the pandemic has been playing out in our state. From February till June, we had about 900 cases, almost exactly 900 cases throughout those several months. And during that time, we had a very quiet May because people did such a good job with the governor's order by staying at home, suppressing the virus, and we got fairly comfortable. However, when July hit, we had July 4th weekend, we had opened some of our Kama'aina economy. We had celebrations like all Americans do on July 4th weekend. We started to see some spread. Essentially, it was like a small fire that sent sparks out, and those sparks became other fires. In that month, we had 1,200 cases, and that was at the beginnings of what we thought was a surge. That was 20 and 30 cases a day. We also saw a small increase, a very small increase in our hospital capacity at that time. People were going to the hospital, but infrequently. To contrast that, in July, in August, it's been 2,108 cases. And here we are only on August 13th. So we've seen a rapid acceleration of the spread of COVID, mostly because we're seeing clusters at homes, in the community, and in some cases large clusters. A couple weeks ago, we saw the beginnings of a large growth of the disease in the Pacific Islander community. And we're also seeing essentially bursts of the disease in other settings, for instance, among the homeless community, which Scott Morshige is going to share with us in a few moments. So 2,100 cases in August. Now, it's important that I share with you what the impact of that means. So overall, what we also address is how many active cases there are in our state. That's important because many people, of course, get over COVID without too much problem. Others, however, get sicker. At the moment, we have 2,558 active cases total. Almost all of them, 2,477 of those cases, are on Oahu. There is some active COVID disease on the neighbor islands, but most of it is on Oahu. And this has significant implications for how it will play out in our hospitals. A basic refresher course with my medical hat on. Of the cases that we've had, and now you know we've had about 4,000 cases total, and like I said, 2,558 active cases here in our islands, 11% of all cases that we are able to diagnose with a test have resulted in a hospitalization. So out of those cases that we have active right now, we can expect another approximately 275 individuals to need hospital services to get well. Let's talk a little bit about what's happened in August so you can get a good perspective on why the governor is being very serious, and appropriately so, about what we're going to have to do in our state. On August 1st, we had statewide 177 cases cumulative to date that had been hospitalized. So 177 of our people, all the way through the pandemic, had gone to the hospital. It really was not very many. It was the lowest number in the country. And on that day, 13 days ago, we had 75 individuals, 75 of our citizens, in the hospital, mostly doing okay, but getting oxygen treatment, a few people in the intensive care unit. Things have changed somewhat. Here we are, today, Thursday, August 13th. We now have had a total number of 258 cases, but we have exactly twice the number that we had on August 1st in the hospital. We now have 150 individuals and probably a couple additional cases that have been admitted even since we wrote this card in the hospital. And the cases are becoming more severe. We've seen an uptick in cases in the intensive care unit and on ventilators. In this 2-week period, 81 plus additional people have been hospitalized. And unfortunately, some people do die, as we heard today, and our hearts just break when we have to report that a young person or an older person has been sick. And most of the fatalities have been among the older individuals, our kupuna, but we did have a 44-year-old who passed away. So it can affect all of us, and that's why it's so serious when the governor says, please socially distance, follow the restrictions that we put in place, and wear masks. Hawaii is a small state, so we have somewhat limited healthcare capacity. We have 244 intensive care unit beds statewide, and that number is absolutely necessary. We've instructed our hospitals to all prepare to expand their capacity if necessary. As of this morning, 137 of those 244 intensive care unit beds were occupied. That's 56%. Most of those beds in the ICU were occupied by individuals that did not have COVID, people who had heart attacks or cancer that were treating. But 29 individuals were in the ICU with COVID, and they're quite sick. As I come toward the end of this presentation, I want to also talk about the other life-saving measures we have available to us. We are prepared with ventilators. We have 459 ventilators available for use at any time in the state. Most of them are on Oahu. 73 of them are being used right now. 22 of those are from COVID patients. Now, the concern I have, of course, is once you're in the intensive care unit with COVID, having had difficulty breathing, it's highly likely that you will struggle. And in many cases, people do pass away in that circumstance. We've had 40 fatalities to date. It's the lowest rate in the country, but that's 40 heartaches. That's 40 families that have lost a loved one. And about 1 out of every 100 confirmed cases have resulted in a fatality. Like I said earlier, you'll talk with our experts additionally about outbreaks that are in our community. Though most of the cases have been community spread, we have seen some spread in a homeless shelter, and I want to say it's actually extraordinary how little spread we've had amongst the homeless community to date, but it's a great concern, and that's why we've got Scott here to talk to us about that. And then, of course, in the jail, in our prison, I should say. And so Director Ospinda will give us better details about that. When people are in prison, if they get sick, they get health care services as well. We want to reassure families, if their family members are incarcerated, that they will get health care, of course. So what's the takeaway of all this? There's a hospital surge happening now. And that hospital surge is something that's been witnessed in Texas, in California, in New York, in Spain, and in Italy, all across the world. But we are in a unique position to respond to that. So what do? We take good precautions. We take to heart the recommendations from the Department of Health. We take to heart the recommendations from our healthcare system and our hospitals. We listen to our people. And if we do need additional restrictions, if we do have to go to a stay-at-home order, it will be to save lives and ultimately stop the virus sooner rather than later. I want to reassure people we definitely have capacity in our hospitals right now, but it is getting closer to the point where we will overflow our hospitals and not be able to give all the services which all of our citizens deserve. That's why we are so serious today and why I'm standing right beside the governor when he calls for additional measures if that's necessary. Aloha.